Well, good morning, everyone. We'll convene the Standing Committee on Public Accounts. Today, we've got a fairly full day before us. I'll introduce members that are here today. Deputy Chair Mr. McMorris, Ms. Lambert, Mr. Weeks, Mr. Fayaz, Mr. Olison, and Ms. Mowat. Just as a note for committee members, this is, I'm told that we're in the final stages of changes to the high definition upgrade. So as a result, today's proceedings are being live streamed online on the Legislative Assembly website and will be archived and broadcast on the Legislative channel at a later date. We have the following items to table. PAC 7928, Ministry of Finance, Report of Public Losses, January 1st, 2019 to March 31st, 2019. PAC 8028, Ministry of Health, Report of Public Losses, January 1st, 2019 to March 31st, 2019. PAC 8128, Ministry of Education, Report of Public Losses, January 1st, 2019 to March 31st, 2019. PAC 8228, Ministry of Education, Report of Public Losses, December 1st, 2018 to February 28th, 2019. PAC 8328, Provincial Auditor of Saskatchewan, 2019-20 first quarter financial forecast for the 3 months ending June 30th, 2019. PAC 8428, Ministry of Finance, Report of Public Losses, April 1st, 2019 to June 30th, 2019. PAC 8528, Ministry of Advanced Education, Report of Public Losses, April 1st, 2019 to June 30th, 2019. I would like to advise the committee that pursuant to Rule 142.2, the following documents were committed to the committee. Provincial Auditor of Saskatchewan, Annual Report on Operations for the year ended March 31st, 2019. Government of Saskatchewan 2018-19, Public Accounts Volume 1, Summary Financial Statements. I'll introduce the officials that are with us here today as well from the Provincial Comptroller's Office. Provincial Comptroller Terry Payton, one of the best fishers in the province, and Chris Beta, Assistant Provincial Comptroller. Looking good there today, Chris. Thanks for being here. And Ty looks sharp. I'd like to introduce our Provincial Auditor, Judy Ferguson, and welcome her officials that are here in attendance here today. I'll be turning it over shortly to you, and you can introduce officials as the pertinent chapters are up for consideration. I'll turn it over quickly to the Ministry of Justice, which is the Ministry of Corrections and Policing, which is the first considerations here today. I'd ask for a brief introduction of officials. I welcome Deputy Minister Larson here today and all the officials that are here. We'll get maybe a brief introduction of everyone that's with us here today, but then we'll turn the attention back to the auditor for a presentation on the chapter and then your subsequent response.
Pleasure to be here today. I'd like to begin by thanking the team of the Provincial Auditor for the good work they continue to do. We welcome your reports, which serve as a helpful guide to identify areas for improvement in our ministry. As you can see, I have a number of officials accompanying me, and they're here today, obviously, to discuss the progress the ministry has made on the 5 chapters noted in the agenda. We thought we would introduce them when they come up to discuss the specific chapter related to their area. Many of the outstanding recommendations in front of you this morning involve complex resolutions, and as you can appreciate, these changes take time to fully implement. With that being said, the ministry feels we have made good progress on some of the recommendations, with further and continued work required on others. As you already have a copy of the status update outlining this progress, I am mindful of everyone's time. Therefore, for each chapter, rather than repeating what is already in front of you, I will render a few brief comments. Following that, we would be happy to answer any questions the committee may have. Thank you.
Thank you very much. And we'll have just a reminder to officials as well, make sure to state your name when you're coming to the microphone and presenting here today. I'll turn it over to our provincial auditor, Judy Ferguson, to respond to they're titled Justice chapters, but through some of the changes, they're now under corrections and policing. You can make the presentations and we'll go from there.
Thank you very much, Chair, Deputy Chair, members, and officials. This morning, I've got Mr. Trevor St. John. Trevor's the Deputy in the office responsible for the portfolio that includes corrections and policing, and also Ministry of Justice, too, so there's a bit of crossover. Behind is Ms. Nicole Dresler and Mr. Jason Wandy. They led a number of the work that's presented in the chapters before us this morning, and Ms. Kim Lowe is our committee liaison. As the Deputy Minister indicated, there's 5 chapters for the consideration of the committee this morning. We're going to present each chapter individually because they deal with different topics. Mr. St. John will pause after each presentation to allow for the committee's consideration. Only one chapter contains new recommendations, and that's the 3rd chapter on the agenda here. It's the only one that contains new recommendations for the committee's consideration. So the committee has seen the prior reports on the other ones. I do want to thank the ministry and your staff for all the cooperation that was extended to us. We recognize it is an array of work that we have done, so it's touched a number of different components of your ministry, and we received excellent cooperation throughout. So thank you very much. Without further ado, Trevor.
So start with Chapter 38 of our 2017 report, Volume 2. On pages 269 and 273, or 273, it reports the results of our second follow-up of the Ministry of Justice's progress towards addressing recommendations we initially made in our 2011 audit related to its processes to rehabilitate adult offenders likely to repeat crimes, including serious or violent crimes, who are serving a community sentence in the Regina-Qu'Appelle region. The Ministry of Corrections and Policing is responsible to deliver programs and services to rehabilitate adult offenders in the community. If offenders do not receive rehabilitation services that meet their needs in a timely manner, the risk of recidivism is much higher. The committee has previously considered and agreed to these recommendations. By October 2017, the ministry had implemented 3 of the 7 recommendations and had not implemented the remaining 4. We found the ministry had made the following improvements. It established processes to monitor whether high-risk adult offenders have timely access to priority community rehabilitation programs. It established a process to evaluate rehabilitation services provided by other agencies before selecting and providing funding to those agencies. It introduced a new policy that requires the ministry to evaluate programs using evidence-based best practices and establish research methodologies. However, the ministry needs to improve the following areas. It needs to consistently follow its case management policies regarding completing timely risk assessments and integrated case plans, have sufficient contact with offenders, and prepare regular progress reports for offenders in the community. This concludes my presentation.
Thanks for the presentation and the work. Thanks as well for the work from the ministry. Do you have brief remarks to this respective chapter, or should we open it up for questions?
I have a few.
Sure.
You may recall the auditor's recommendations were based on a file review from the Regina-Qu'Appelle region. As the recommendations impact the entire provincial rehabilitation system, considerable work has gone into developing initiatives to improve processes to rehabilitate adult offenders in the community. The purpose of the audit is to assess community corrections progress on risk management and risk reduction activities. The overall goal is reductions in recidivism. In 2017, the provincial auditor acknowledged that the ministry had implemented 3 out of 7 recommendations and had made progress on the remaining 4. 3 key items that have presented issues impacting success over the last few years are employee turnover, vacancies in positions, and increased caseloads. Because these things will likely continue to present challenges, they will all need to be managed on an ongoing basis. The key for improvement is implementing significant changes to the way that processes are managed within the community corrections. To this aim, in 2017, the ministry explained that it would be engaging in a large-scale workload review. This important work continues with major changes planned for implementation beginning this fall. Changes will be made to requirements allowing probation officers to complete more risk assessments and case plans. In addition, serious violent offender response, SVOR, has been expanded to Regina and the northeast communities of Pelican Narrows, Sandy Bay, and DeChambeau Lake to provide intensive supervision and rehabilitation to very high-risk violent offenders. It had been previously existed only in North Battleford and Saskatoon. All clients serving a community disposition are supervised by a probation officer or community youth worker. In the event that a client withdraws from supervision and contact cannot be reestablished, a violation report is submitted to the police requesting that client be charged with a breach of that order. As I mentioned in my opening remarks, large-scale changes such as those underway take time to implement. With that said, the ministry has and will continue to prioritize providing services to high-risk clients. Some modest gains have been made in some areas, and changes will continue to be made to allow for improvements in all areas. We look forward to the provincial auditor's next follow-up audit scheduled for the latter half of 2020, and at this time would be happy to answer any questions.
Thanks for the work. I'll also be tabling the status updates that were provided, and thanks to the ministry for providing them. So at this point, I'll table PAC 8628, Ministry of Corrections and Policing Status Update dated September 25th, 2019. I'll open up for questions here. Ms. Mowat.
Thank you, Mr. Chair, and I'd like to thank the Deputy Minister and the officials for being here today, for providing the status update, and also for providing some opening remarks as well, which are always helpful and answer some of my early questions. So that's, I think, good for everyone on the committee. Just to start early in the chapter here, on page 270, the provincial auditor noted management explained that its policy to use integrated case plans between custody and the community is not adhered to in the Regina Community Corrections Office. I'm just wondering if you could speak to why this wasn't the case, and who monitors case plan and follow up, at least at this point in time.
Good morning. My name is Caroline Graves. I'm the Executive Director of Community Corrections. Thank you for your question. So in the documentation, we talk about the fact that we've been engaging in a very large-scale workload review over the last couple of years. And as part of that process, we've been looking at case management as one component of that. So we've looked at particularly what we do in terms of developing the case plan and making sure that as we move forward that documentation looks as it should look. So along with that process right now, we're in the throes this fall, or we will be in the throes this fall, of making changes to our case plan documentation. And then at some point in the future, we'll be implementing that same case plan document within custody facilities.
Thank you. So you've mentioned the workload review a couple of times and in the status update as well. And in the opening comments, the Deputy Minister indicated that there were some major changes that we should expect. I'm wondering if you can elaborate on what some of those changes will look like and what impact you expect them to have.
I'd be happy to. So we have 3 different streams that we've looked at through the workload review process. So one is our supervision standards. The second is how we do assessments and risk assessments, and the third is, as I'd mentioned, the case planning process. So in terms of supervision standards, we've done a very thorough review of taking a look at all of our client groups that we see. We've looked at each risk level. We've looked at each type of client. So we've looked at high, medium, low. We've looked at bail clients. We've looked at each particular group. and done some work in terms of what those supervision standards should look like going forward. So that's one component. The second that we've looked at is our risk assessment process. So really what we've tried to do in that process is to reduce redundancies in the paperwork. So to really look at how do we streamline that process and to make sure we're getting all of the information that we require, but doing it in a very thorough, consistent way. And then we've also been looking at the case management process. So it's really all of the pieces that I've talked about are really germane to the work that we do in community corrections. It's the work that our staff do every day. So we've really looked thoroughly at every component.
Thank you. In terms of workload demands, is there anything that has been done to address those workload demands, basically actions that have been taken now, or is this something that is being, is waiting for the workload review to be completed?
Excellent question. Thank you. We have been looking at where we can try to make some minor improvements over the last couple of years, but really the focus has been largely on this workload review and making more massive changes versus small little tweaks. And as Deputy Minister Larson had mentioned earlier, we've been a bit challenged in the last couple of years. One of the challenges has been in terms of caseload and some increases in numbers. One other thing that we've seen an increase of is we write reports for the court. So we write pre-sentence reports and we write bail verification reports. And in the last couple of years, we saw a 30% increase in terms of the number of bail verification reports that we wrote, which is a good thing. It's a good thing that we're doing that work and contributing to the criminal justice system in that way. It's a great thing, but it has presented some challenges.
Thank you. You were mentioning the fact that the caseload has increased. How many cases is each employee responsible for? I'm wondering if you have an average or how you track it.
I do, and I can give you as much information as you'd like in terms of our caseload sizes. So some examples of our caseload for rural offices, for instance, in Buffalo Narrows, and this is just one example, but it would be consistent across our rural offices. You could have up to 67 files for each worker, and then because they're in rural locations having to travel to see their clients, there's also extensive travel that is required. And then in urban offices where we have intake and case management units, the intake units could have up to 102 files per worker, and case management units could have up to 111 files per worker. And then if we look at if community corrections is fully staffed, if we were in a situation that we were fully staffed, which we've been challenged to be over the last few years, on average, caseloads would range from 45 to 60 for adult clients and 25 to 30 for youth clients. And those numbers, of course, can vary depending on the location in the province. They can also vary by type of caseload. So, for example, we have a serious violent offender response, and we work jointly with police, prosecutions, mental health as well in terms of working intensely with those clients. And because of that intense level of partnership, those caseloads are limited to 15 clients per staff. So it all depends on the location, the type of caseload, but overall, that would be a summary of what the caseloads look like.
Thank you. And has there been any changes to FTEs since the report was released?
In last year, it would have been in 2017, I believe, we got 3 additional FTEs in community corrections for, it relates to, it's called the CAR program, Community Alternatives to Remand, so focusing on bail. But that has been the increase in that time.
Where are those 3 FTEs located out of?
Saskatoon, Regina, and Prince Albert.
Okay, thanks. And what is the status of the new IT system?
CGIMS was implemented in community corrections, so all of our staff were trained in 2015 in relation to that system.
Okay. There's also a mention of pilot projects, 2 pilot projects to allow for better coordination. What was the outcome of those pilots? Is there a plan to expand? So I'm just on page 271 as well.
So in this, I believe if I'm following, this recommendation relates to the connection between community corrections and custody facilities. Yes. So in June of 2017, in our Saskatoon Community Corrections Office, we began providing what we term in-reach services to offenders serving custody sentences. And there's one dedicated probation officer who goes in and completes the risk assessments on offenders who will be released to a community sentence, and they do that prior to their release from custody. The aim of that is to be able to then, when the client is released, to be able to connect them with services immediately. So we initially operated that as a pilot in Saskatoon. We've had great success with that. So we've replicated that. It's been implemented in the Regina office in the summer, and we just started in Prince Albert in September as well.
Thank you. Just in general, we're talking about rehabilitation and the overall goal of reducing recidivism. Has there been any progress toward reducing recidivism rates in the province?
Unfortunately, at this point, as I'd mentioned, we implemented the new system called CGIMS in 2015. Prior to its implementation, with the old system, we were able to run reports to actually really regularly check the recidivism rates. And our folks with IT are working on getting that capability within CGIMS. It's not quite there, but they're working on getting that. So we'll be able to run those reports regularly to see exactly what's happening in that regard.
Okay, thanks. So as I understand it, so since CGIMS has been implemented, we haven't been able to track the recidivism?
That's correct.
Okay. Thank you. I have no further questions on this chapter, Mr. Chair.
Thanks for the questions. Thanks for the responses. Any other questions before we move along? I'll turn it back over to... Right. Well, we don't have any new recommendations here. These are all outstanding, so we'll simply need to conclude consideration of this this chapter. Someone moves. All agreed? It's carried. We'll move along back over to the Provincial Auditor's Office.
The next chapter is Chapter 39 of our 2017 report, Volume 2, on pages 275 to 276. This reports the results of our second follow-up of the Ministry of Justice's progress towards addressing two recommendations we initially made in our 2012 audit related to the integrity of offender data. The committee has previously considered and agreed to these recommendations. The Ministry uses an IT system referred to as CGIMS to track release dates of prisoners. If information in its IT system is not accurate, offenders may be released at the incorrect time. By September 2017, the Ministry had implemented one of the two remaining recommendations and had partially implemented the other. We found the Ministry developed a policy for community corrections offices to require a supervisory review of files and data changes. The policy requires supervisors to confirm that the data clerical staff enter in CGIMS matches the information in the individual's court order. However, the Ministry continues to need to follow its procedures for removing unneeded user access to its IT system. We provided a detailed update for this recommendation in our 2017 Volume 2, Chapter 8, page 58, as well as 2018 Volume 2, Chapter 10, page 61. As of March 2018, this recommendation remained partially implemented. This concludes my presentation.
Brief comments from the Ministry.
Thank you. The outstanding recommendation in this chapter is one that has been around for some time and affects many ministries. It relates to timely removal of user access. There really are two components to this discussion, the first being removal from Government of Saskatchewan accounts, with the secondary component being removal of access from ministry-specific IT systems. The Ministry has made progress towards implementing this recommendation by incorporating additional measures to see this issue resolved. This spring, the Ministry and the Public Service Commission got together to implement a process to automatically receive notification of an expected staff departure. Also in August of this year, the Ministry modified its processes for removal of user access to ministry-specific IT systems. We also recently completed an internal test of employees exiting the Ministry. The results of this review indicate both ITD and CGIM support are doing a good job of removing access in a timely manner when they are advised the removal is required. The issue lies with the timely notification by ministry staff to PSC or system administrators of the employee exiting the ministry. With that being said, I have sent out 2 communications, one to my direct reports emphasizing the importance of protecting government information. I asked that they cascade that information down to all supervisors in the ministry. And the second communication was to the executive coordinators in the ministry, as they play an important role to manage employees both entering and exiting the ministry. The ministry understands the importance of getting this issue resolved, and our goal is to consider this recommendation fully implemented by the end of this fiscal year. We're happy to answer any questions.
Thanks for the work and the presentation. I'll open it up for questions. Ms. Mowat?
Thank you, Mr. Chair. So this issue of timely access yet again, but I do want to commend the Deputy Minister on the actions that have been taken in this area. It does look like there's been, according to the status update, a thorough set of actions and efforts to remove user access, users who shouldn't have access anymore. So I just want to make a note of that. I'm wondering if we can get an update on, so on page 275 in the beginning of the introduction, there's some numbers here that were provided by ministry officials in October 2017. I'm wondering if we can get an update on these numbers right now. So it says, as of September 30th, 2017, the Saskatchewan Correctional System was responsible for 9,590 offenders. So how many offenders? With 1,966 in custody and 7,624 under community supervision. So if we can get an update on those 3 numbers, that would be great.
Those 3 numbers are pretty close to current. As of yesterday, we had 1,970 adult offenders in custody, and the community is around the same number, I think, of 7,000. It might be a little bit higher. 7,393.
Okay, thank you. I have no further questions on this chapter, Mr. Chair.
Any other questions? Ms. Lambert? No? Mr. McNeil?
Quick one on the access to government employees that are not, this is not unique to corrections. This is kind of a reoccurring thing. Is it really just a communications piece for people? Like how, I struggle sometimes to know why, when a person is no longer employed, they're not taken off the system immediately. And is it just really a communications issue, or can you give me a practical example and why the person didn't get taken off?
That's a good question, Ms. McMorrison. I struggle with that concept as well. In this day and age, I mentioned to discussion with staff the other day regarding this issue that you would think that once the trigger is activated for a removal, there would be an automated system that would just follow with the process and take that person's name out of any system that is in government. But I'll refer to Rick or Monica in relation to the specifics of that question.
Good morning. Rick Davis, the Director of Enterprise Business Support. I think your assumption is very accurate from our findings. We're seeing that, as Deputy Minister Larson indicated, that when our systems administrators are notified, the removal is happening timely, like within a day or 2. Where there's the delay in the removal is when our systems administrators aren't notified from the people in the field at the front lines in the facilities and offices around the provinces in that timely manner. Now, we've taken a lot of different steps lately and in the past to try to ensure we're getting that notification quicker, and we'll continue to monitor that now.
This may sound really simple and elementary, but for whoever the supervisor is that is in charge of a person that is no longer going to be coming to work tomorrow, is there a checklist that they have to follow and say, notify someone above me?
No, it's a fair question, and yes, there is a checklist, and the checklist includes all the steps for when somebody's leaving employment, and removing them from the systems and providing the proper notifications is on that checklist.
Very good questions, common sense. Thank you very much. Any other questions, or are we ready to conclude consideration of Chapter 39? Moved by Ms. Lambert, all agreed. That's carried. We'll move along to the chapter that has new recommendations within it, so we'll have to have some motions with respect to those recommendations. I'll turn it over to the Provincial Auditor's Office.
All right, thank you. Chapter 3 of our 2018 report, Volume 1, on pages 25 to 38, reports the results of our audit on the Ministry of Corrections and Policing's processes for the provision of primary medical care to adult inmates in its secure custody correctional centers. This chapter includes 9 new recommendations for the committee's consideration. Primary medical care refers to first contact care that family physicians, nurses, or other medically trained personnel typically provide. It includes medical care upon admission to correctional centers, urgent care, health promotion, disease prevention, and follow-up care. Research shows inmates are at a higher risk to obtain infectious diseases than in the community. If this is not addressed prior to inmate release, a risk of new diseases and untreated conditions could decrease the well-being of the community. At the time of the audit, Saskatchewan had about 1,800 inmates in its 4 adult secure custody correctional facilities. These facilities continue to face overcrowding. Many inmates came from vulnerable backgrounds that can increase the likelihood of having declining health. Also, many have untreated health conditions when admitted to correctional centers. We concluded for the 12-month period ended November 30th, 2017, the Ministry of Corrections and Policing had effective processes other than the 9 areas reflected in our recommendations for the provision of primary medical care to adult inmates in its secure custody correctional centers. I will focus my presentation on those 9 areas and related recommendations. In our first recommendation on page 30, we recommend the Ministry of Corrections and Policing deliver orientation training for the nurse manager positions in adult secure custody correctional centers. A nurse manager is either a registered nurse or a registered psychiatric nurse that helps the medical unit provide quality care to inmates. Although each of the 4 correctional centers staff the nurse manager position with appropriately qualified medical personnel, nurses receive little to no orientation when they started. The working environment of a secure custody correctional center differs from a hospital. Rather, nurse managers were expected to learn their role while on the job. In November 2017, most of the nurse managers had been in their role less than 2 years. Without comprehensive initial orientation training, unprepared nurse managers may struggle in this key role in the correctional center. This can lead to staff turnover. In our second recommendation on page 31, we recommend the Ministry of Corrections and Policing monitor the currency of first aid certifications of correctional staff from adult secure custody correctional centers. Regular first aid training helps correctional staff possess sufficient skills to readily respond in the event of an emergency. The ministry appropriately requires all correctional staff to hold a current first aid certification. This is particularly important because medical staff at each center do not work during the night. Nursing staff deliver medical care from 7 a.m. to 11 p.m. Each of the 4 centers formally track when each correctional staff was last certified for first aid and the certification expiry dates. However, one correctional center was not adequately monitoring whether its staff maintained their certification. As of November 1st, 2017, only 65% of staff at this center were certified, compared to between 85 and 99% of staff at the other 3 centers. Not monitoring whether staff maintain current first aid certification increases the risk the center does not have sufficient correctional staff trained for potential medical emergencies. In our third recommendation on page 32, we recommend the Ministry of Corrections and Policing regularly update medical care policies for adult secure custody correctional centers. The ministry's 21 policies related to medical care in adult secure custody correctional centers are not complete and do not cover some key topics such as psychiatric care and treatment plans. In addition, the ministry has not reviewed and updated policies that were assessed as important as it expected. Since 2016, the ministry updated only 3 policies related to medical care. It found it last updated other medical-related policies between 1996 and 2006, 10 to 20 years ago. Incomplete and outdated policies increases the risk that policies do not provide relevant guidance to staff and lead to inconsistent staff actions and operations. In our 4th recommendation on page 32, we recommend the Ministry of Corrections and Policing have adult secure custody correctional center staff regularly update medical care directives. The ministry expects each correctional center to develop directives that help or operationalize ministry policies. It recognizes the delivery of correctional services may differ between facilities because of differing inmate populations and differing genders. All 4 correctional centers do not routinely review and update directives related to medical care. 2 of 4 centers did not have any directives on the medical admission process. Additionally, of the 38 medical care directives we tested, correctional centers had not reviewed over 60% of them within the last 1 to 13 years. Not having directives for medical admission increases the risk that nurses do not assess inmates' medical needs consistently at intake. A lack of or out-of-date directives increases the risk of inmates not receiving consistent and up-to-date medical care. In our 5th recommendation on page 34, we recommend the Ministry of Corrections and Policing require staff to transfer inmate medical files between adult secure custody correctional centers when it moves inmates between centers or former inmates re-enter the system. Each center maintains manual medical files on their inmates. It routinely moves inmates between centers. When transfers occur, the transferring center transfers only nurse-to-nurse notes instead of the inmate's entire medical file or copy thereof. Nurse-to-nurse notes are limited to information about current medical treatment and do not give information about past treatments, observations, or medical history. Having an inmate's complete medical file available facilitates a continuum of care and avoids replication of tests. Not transferring complete inmate medical files can increase the risk that an inmate receives inefficient or inappropriate medical care, putting their health at risk. Switching to electronic health records may be an efficient way to accomplish this. In our 6th recommendation on page 36, we recommend the Ministry of Corrections and Policing formally respond to adult inmate complaints about medical care within time frames required by the Correctional Service Regulations. The Correctional Center Directive receives complaints and assigns medically related complaints to the center's nurse manager. The nurse manager is responsible for responding to and resolving these complaints. The inmate can appeal a nurse manager's decision or resolution to the Correctional Center Director. The Correctional Services Regulations require the ministry and centers to respond to an inmate complaint within 5 business days. When the center cannot reach a final decision within that time frame, the regulations require to issue written interim responses to help keep inmates informed of the status of their complaint. The ministry and the 4 adult secure custody correctional centers received almost 300 medically related complaints in the 12-month period ended November 30th, 2017. Our analysis of these complaints found almost 30% of the time staff responded to inmates later than the law requires. It had an average response time of 8 days instead of 5 business days. At November 2017, only 2 of the 4 correctional centers tracked if staff sent interim responses to inmates. Not providing timely responses to inmate complaints about medical care runs the risk of an inmate's health being jeopardized. In our 7th recommendation on page 37, we recommend the Ministry of Corrections and Policing periodically analyze complaints about medical care from adult inmates in secure custody correctional centers for trends and take corrective action as needed. The ministry had not analyzed complaints to identify recurring types or trends. Our analysis of the 300 complaints found about 40% of them were about medication. By not assessing trends in the type of complaints to identify systemic or recurring issues in the delivery of medical care, staff may miss opportunities to adjust processes or improve communication. The next 2 recommendations are related. In our 8th recommendation on page 38, we recommend the Ministry of Corrections and Policing work with adult secure custody correctional centers, develop measures for evaluating the provision of medical care to inmates. In our 9th recommendation, we recommend the Ministry of Corrections and Policing receive regular reports from adult secure custody correctional correctional centers on the provision of medical care to inmates. Other than information tracked for a 3-month period, the ministry did not track key medical care activities or measures. The medical units at each of the 4 centers do not have measures to evaluate the medical care they provide to inmates. Staff do not record evaluative information for overall medical care. Without measures to evaluate the provision of medical care, the ministry does not know whether inmates receive care consistent with its policy. Also, without measures, the medical units cannot identify areas of provision of medical care that they could improve. That's all.
Thanks for the presentation and the really important focus of this chapter. I'll turn it over for brief responses from the ministry and then open it up for questions.
Thank you. As the auditor's report states, there's no expressed reference to medical care services in the Corrections Services Act 2012. However, the ministry provides medical services to inmates in each of the province's correctional facilities. The ministry recognizes the importance of and accepts the auditor's recommendations. Since the auditor's report was released mid-2018, the ministry feels it has fully implemented 3 and partially implemented 6 of the recommendations. We are happy to answer any questions the committee may have.
Thank you all. Up for questions. Ms. Mowat.
Thank you very much. Just to start, on page 29, there's a discussion about the medical personnel that are available to inmates. I'm wondering how many hours a general practitioner is on site each week in each facility.
Assistant Deputy Minister. So for our 4 facilities, the GP at Prince Albert Correctional Centre is 6 hours a week. Pine Grove Correctional Centre, which is our facility for women, is 8 hours a week. Regina Correctional Centre is 11.5 hours a week. White Birch, which is our remand facility in Regina for women, is 3 to 4 hours a week. Saskatoon Correctional Centre is 8 hours a week.
Thank you. And can you also provide the corresponding wait times to see a general practitioner at each facility?
Sure. For PA Correctional Centre, it's 1 to 2 weeks. Pine Grove Correctional Centre, 30 days. Regina Correctional Centre, 2.5 weeks. White Birch, 1 week, depending on the day of the admission. Saskatoon Correctional Centre, 2 to 4 weeks. Right.
Thank you.
Just a comment is those clients that are in need of medical assistance or care, they're triaged as well. So it's not that they're waiting for the doctor to come into the facility. They'll be escorted to health care in the community if needed.
Thank you. There's the discussion about the nurse manager orientation that's required on page 30. There was some, the auditor mentioned it, and it was also mentioned in the status updates as well. I'm just wondering if you can expand a little bit on the information that's in the status update about how this training has been improved or will be improved. It's just, it's not very clear to me what stage we're at in this process.
Hi, I'm Doris Schnell. I'm the Executive Director of Offender Services. So since this recommendation occurred, we've met with the nurse managers to try and determine what the gaps in services are, what they're saying is gaps in services. A number of the issues are leadership, those types of skills that they wish they had. They're put into a position where they're supervising a group of nurses and having to interact with a group of correctional officers as well. So they're looking for information about specifically how a correctional facility works, because some of them come from outside, and some additional leadership skills around managing people, Those are the sort of things that were identified to us. I also want to add that our nurse managers do change over quite regularly. So the nurse managers that we are working with now around the orientation package are actually different nurse managers than the ones that were interviewed during the audit as well.
So is there a thought of a specific type of course that will be provided or specific training that will be provided, or is that information solidified yet?
It's not solidified yet. We've been working with learning and development around what sort of things are available, what sort of things they might be able to, what we might be able to do online rather than in person. They need the training, but their time is also very valuable in the clinics. So what kind of things we can offer them that's online. So some of the things we've been looking at is things like dealing with conflict constructively, some of those kinds of things as well. There will be a curriculum completed we've got the date set for March the 31st of this year, and then we'll implement it with them.
Okay. You mentioned the turnover. The auditor noted that in November 2017, most of the nurse managers had been in their position less than 2 years. How do you measure the turnover rate? What does it look like right now?
We haven't formally measured the turnover rate, but it is an issue, and there is turnover within our nurse manager ranks within the correctional facilities. Some of our nurse managers, they opt to go to the health authority to work or in other areas of the government to work.
Okay.
Just on that,
yeah.
just on that point, before we move along, do you have an assessment or an understanding of why that's happening? It's sort of work conditions or compensation, or what's the cause?
If I understand your question, you're asking if we've done exit interviews with the nurse managers?
Yeah, so as part of understanding why there's such a high level of turnover.
We haven't done formal exit interviews, but the nurses do acknowledge it is a difficult working relationship. Like any working situation, any job in a correctional facility can be a difficult situation. Those are some of the things that they identify.
It seems like an important area to focus some attention, because I'm sure turnover is a challenge as well when you're wanting to have those services extended. Ms. Moen?
So just looking at the availability of medical care on page 33, there's a discussion about the fact that most inmates who refused the initial assessment on admission came from the same correctional facility. Just wondering what facility that is and whether this has been looked into.
I believe that was Saskatoon Correctional Facility. Yes, we've been problem-solving ways to deal with that. One of the issues with the way that Saskatoon Correctional Facility is structured is there isn't a lot of room to do a medical intake immediately when they arrive, and so they go to their home units, and then sometimes once they're settled in their home units, they're less willing to want to come back to do the medical assessment, so they refuse the medical assessment. So we're problem-solving ways. There's been sort of a reorganization of some of the nurses' duties to try and make sure that we have nurses available initially when they come in, and then we're trying to work with making space for that. But it continues to be a challenging situation.
So are they using alternate spaces for interviewing, or is this primarily a space constraint, would you say?
Yeah, no, they are looking at alternate spaces, yes.
Okay. With regards to the 8th and 9th recommendations, that the ministry develop measures for evaluating the provision of medical care to inmates. So the plan is that audits will be completed, and it looks like the first one will occur in December 2019. I'm wondering what that process will look like in terms of how medical care will be evaluated in the correctional centers.
So one of the things that we're currently looking at that's referenced earlier is an electronic health record. We're doing some research on that right now. Currently, all of our medical files are held on paper files. So being able to evaluate the medical services would be a lot more straightforward and a lot more efficient if we had an electronic medical file. But what we plan on doing with the nurse managers is taking a certain portion of their time that they'll dedicate to audits. I mean, they already oversee what the nurses are doing and look at their work on a daily basis. But we're going to develop a specific audit schedule in terms of things they'll look at. So the timeliness of the initial assessments that were done, whether or not the referrals were made to the practitioners that they should be made to, whether or not those were followed through, what the timelines were in terms of following those through. We're also going to look at analyzing our complaints. We're rolling those up on a regular basis now as well. We plan to do that on a regular yearly basis to be able to evaluate service.
Okay. I have no further questions on this chapter, Mr. Chair.
Mr. McMorris?
A couple questions, and I certainly appreciate the high turnover in the nurse managers. I can just imagine it can be very difficult setting to work in. And the orientation package, whether it would help them last another years, if they had a proper orientation right off the bat, would that keep them there for an extra year? I kind of wonder if that's the case, because I think it's more the environment and the conditions they're working in than whether they were properly oriented to begin with. But having said that, we're not unique. This is probably not unique. Saskatchewan's not unique compared to other provinces. Have we looked at what is done in other provinces as far as when staff comes on, and in this particular case, it would be nurse managers, any sort of orientation that's done in other provinces that we can, we don't really have to reinvent the wheel, because we've got, if we just take the three prairie provinces, I'm sure the situation is very similar in Manitoba and Alberta as it is here. Have we looked at what they've done as far as best practices?
We have done a jurisdictional scan, and we are part of a federal, provincial, territorial working group on healthcare in correctional facilities. A number of the jurisdictions have transferred health services to the Regional Health Authority and the Ministry of Health. So that is something that we are looking at right now in terms of providing the appropriate and adequate care to our clients in the correctional facilities.
Which, if I could, just kind of leads into my second question regarding electronic medical health records. And it's interesting that you're still on paper and talking about maybe looking at an electronic medical record. We've spent a lot of money in this province on electronic medical records. And I'm surprised that people in the corrections facilities do not have access to the provincial database. And that would seem to make a very logical step, that we would access the provincial medical record database as opposed to reinvent the wheel again. Okay, thank you.
Good questions. Ms. Lambert?
I heard that when it comes to the adult inmate complaints, there's something like 30% that are surpass the recommendations for response. And so we heard about a policy refresh, where was that in relation to that 30% that still aren't dealt with in a timely manner according to the legislation?
Recommendation number 6.
Yeah.
Number 6, I think.
was.
And I think there was identified that they were supposed to be responded within 5 days, and I believe the report I heard said that I think 8 was the average, so certainly that's a concerning situation.
Yeah. Do you want me to go ahead and answer? Definitely. Sometimes it's difficult for us to respond in 5 days because we don't have all the information we need. So sometimes the complaints actually go beyond the person's stay in a correctional facility. So we're actually looking for information from previous health providers as well. So, and there's different reasons why we missed the 5-day time frame. But what we did do is a refresh that if we're having difficulty, the first direction is we need to respond within the 5 days. The second direction is if we can't respond within the 5 days because we're still waiting for information, then we need to send out that other letter that says we're looking into your concerns and we will get back to you. So the refresh was around both the timelines and what to do if we can't meet the timelines. So we are now monitoring that on a regular basis. We've set up a database where we collect that information in the facilities, and then also the complaints that we respond to at a central office level, we also collect those as well. Now, I don't have a number for you right now in terms of where we're at. We can certainly look at the database.
Okay, thank you.
So thanks for providing some of the context there, but it calls for the communication to the inmate within 5 days, correct? Ideally, you have resolution or, that you're able to action or respond within that period of time, but I think the communication is pretty critical. What I'm hearing is that you've changed practice so that if there's complicating factors to resolve the complaint, the communication's now happening within the policy, the 5 days. Is that correct?
That's correct.
Would there be any examples of a breach of that, or is someone not having communication within 5 days of their complaint then?
I would have to go back and look at the database to give you that information.
Some of the context or some of the challenging factors, I think, were identified certainly by you in this work and the auditor as well, and Deputy Chair McMorris around access to that medical records as well. So I think that the response from Deputy Minister Larson that, it would make sense to have access to that record certainly seems like a worthy area to pursue. Any other questions? I think that 3 of the recommendations have been implemented as reported out by the ministry here, 2, 6, and 7. I'm wondering if, I see Ms. Lambert, would you care to move that we concur?
The recommendation and no complaints.
Okay, with recommendations 2, 6, and 7, all agreed? That's carried. With respect to the other recommendations, 1, 3, 4, 5, 8, 9, there's certainly been actions taken on all fronts. So I think, would someone care to bring a motion to concur in no progress? Ms. Lambert?
I concur in no progress to numbers 1, 3, 4, 5, 8, and 9.
All agreed? All right, that's carried. Okay, we'll conclude consideration of Chapter 3 at this point, and we'll move along to Chapter 29 of the 2018 Volume 2 report and turn it over to the Provincial Auditor's Office.
Thank you. Chapter 29 of our 2018 report, Volume 2, is on pages 215 to 219. This reports the results of our first follow-up of the Ministry of Corrections and Policing's progress towards addressing 6 recommendations we initially made in our 2016 audit related to processes to plan for inmate capacity at its adult correctional facilities. The committee has previously considered and agreed to these recommendations. Strong processes for facility capacity planning is key for having safe and humane conditions for inmates and correctional officers, including allowing space for effective rehabilitation of inmates. By July 2018, the ministry had implemented 3 of the 6 recommendations, partially implemented 1 recommendation, and was still working on the remaining 2. Key improvements included establishing written guidance for use in capacity planning, completing an analysis of alternatives to meet the needs for facility space, and updating written contingency plans to meet unexpected changes in capacity. The 3 areas requiring further work are defining how the ministry will determine the inmate capacity of its existing adult correctional facilities to guide facility capacity planning decisions. Not defining the inmate capacity of its existing correctional facilities makes long-term capacity planning difficult. It increases the risk that the ministry may not make effective decisions about utilization, modification, or construction of new facilities. It also needs to forecast demand for rehabilitation program space in its adult correctional facilities, including consideration for space required for housing inmates, along with space required for rehabilitation programs. Not having timely forecasts for demand of rehabilitation programs increases the risk that corrections and policing may not have sufficient and adequate space when needed to rehabilitate inmates. The third area is developing a written long-term plan to manage inmate capacity in its adult correctional centers. Not having a written long-term plan to manage inmate capacity in its adult correctional facilities increases the risk that corrections and policing may not have the right space to provide adequate housing for adult inmates at the right time. It also increases the risk of incurring higher operational or construction costs than necessary. Our office recognizes these are areas that are complex and may take time to fully address. This ends my presentation.
Thanks for the presentation. I'll open it up to the ministry for a brief response, then open it up for questions.
Thank you. As mentioned from our last meeting with the provincial auditor, we had 3 recommendations still not fulfilled. One was considered partially implemented and 2 others were considered not implemented. The first recommendation found on page 217 of Chapter 29 in the 2018 Volume 2 report was considered not implemented at that time. The recommendation states, we recommend that the Ministry of Justice develop a written long-term plan to manage inmate capacity in its adult corrections facilities. Acknowledging that final completion status is still required from the provincial auditor, the ministry considers this recommendation implemented at this time. The ministry completed the long-term plan document on July 31st of this year. The long-term plan includes themes such as definitions, demand forecast, and program space. The next recommendation on page 217 of Chapter 29 was considered partially implemented at that time. The recommendation states that we recommend that the Ministry of Justice define how it will determine the inmate capacity of its existing adult correctional facilities to guide facility capacity planning decisions. Acknowledging that final completion status is still required from the provincial auditor, the ministry considers this recommendation also implemented at this time. The ministry has developed a definition for capacity that will assist in guiding our planning decisions. The ministry completed an analysis and developed unit-by-unit, facility-by-facility templates of bed space capacity. The ministry has incorporated this information into its long-term capacity planning document, and the ministry will conduct annual reviews to confirm capacities. The final recommendation on page 218 of Chapter 29 was also considered not implemented. The recommendation states, we recommend that the Ministry of Justice at that time promptly forecast demand for rehabilitation program space in its adult correctional facilities, acknowledging once again that the final completion status is still required from the provincial auditor. The minister considers this recommendation implemented. The ministry has created a best practices ideal ratio of program space for offenders. This has allowed the ministry to forecast its demand for rehabilitation program space in adult correctional facilities. The ministry has included this forecast demand in the long-term capacity planning document. Overall, the ministry feels confident in the actions taken since the release of the auditor's report in December of 2016 and in the capacity planning process we have created. We look forward to meeting with the provincial auditor to go over our final completion status, and we welcome any questions from the chair and committee.
Thank you. Questions? Ms. Mowat?
Thank you. So starting out in the chapter, there's a little bit of information about the percentage of inmates that are on remand. I'm wondering what the current percentage is.
As of yesterday, it's The total count in adult corrections was, as I mentioned a few minutes ago, 1,970. 970 of those are on remand.
Do you know what that percentage is? I guess I can calculate it later.
Close to 50%.
Yeah, so it's slightly higher than it was in the last report, because I think we're at 46% in this chapter. In terms of the development of the long-term plan for facilities, so I see that the long-term plan was finished. So there's some planning that's been taking place. What are some of the results of the long-term plan? So are there future considerations that for adding capacity that are being discussed right now?
Hi, Mark McFadden, Executive Director of Custody Services. So part of the benefits of the long-term capacity plan, if approved by the Provincial Auditor's Office, does allow us to better plan for long-term capacity in such a way that when we're doing our capital planning each year, when we're trying to determine our bed needs over the next 3, 5, 10 years, it allows us to put capital budget submissions in for that, which we have done based on this document. The other thing that it allows us to do is, in particular for programming space needs, both in our existing infrastructure and in future infrastructure needs, it gives us a sense of what we're requiring for programming space for our offenders.
Thank you. So in terms of the long-term plan, just to go back to the topic of the last chapter where there were existing space constraints within existing facilities and existing capacity. So is there a big challenge ahead? Like how does this look? Yeah.
I think it'd be fair to say that there's a challenge ahead. But with our infrastructure that we have now, we're creative in using the space that we have, both for occupancy and both for our programming needs. So we've been fortunate enough to create or empty out some program space that was occupied by beds and convert it back to program space, which we're proud of. But then there's other areas that we have had to put beds in, which has had some impact on some sense of program. But we've been in the facilities, we've been creative in working around it.
But just in follow-up to your question, it's any type of major capital. There's a very long process before you get to the design and construction to a shovel in the ground. So are we going to have challenges based on our count projections? We are anticipating that, and we are planning to address it.
And that's something else I was going to ask is in terms of the ability to forecast demand. So it's great that a demand forecast is part of the long-term plan. What does that actually look like? What is the forecasted demand into the future here?
So our forecast demand, which we have outlined in our capacity planning document, would demonstrate that probably in the next 10 years we're going to need upwards of 200 beds.
In the next how many years, sorry?
10 years.
Okay. Is the plan something that is being made public or could be made available?
I think our next step, as I understand it from the process, would be for us to share it with the Provincial Auditor's Office and team, and based on the status that they give us on the plan, then that would be a discussion that our Deputy Minister would have as far as publicizing it or not.
Okay, and sorry if I missed when that discussion is going to take place with the auditor's office.
I don't.
There's nothing.
There's no
schedule at this point.
In terms of the recommendation that's on page 218. it's talking about the fact that in meeting needs for adult correctional facility space, some of those alternatives might be those that don't require construction. So what are some alternatives that exist? So the provincial auditor notes that other related actions include early case resolution, community alternatives to remand. Can you speak to what these programs look like?
So I can explain what the early case resolution is, but it may be more appropriate for prosecutions to be speaking to the successes or whatnot in that. But early case resolution is where the prosecutions and legal aid meet prior to weekly court to try to resolve cases, and with the intent of maybe not having somebody sitting on remand for as long. So, but as far as rates go, that would be probably a question for prosecutions and on that side. Some other, I'll say, non-capital initiatives would be we've introduced, well, we always had them, but we've put a greater focus on reintegration leaves. So for offenders, sentenced offenders in our facilities, all caseloads need to be reviewed for eligibility for reintegration leave. What a reintegration leave allows for is for an offender to obtain maybe more structured and more appropriate programming in the community, given that they have the necessary supports in the community, whether it be employment, whether it be education, whether it be family support, things like that, where their rehabilitation may be more effective by accessing services in the community.
Thank you. And is there any indication of what impact these programs have had on remand numbers?
Well, that's for sentenced offenders, so not for remand offenders.
Okay,
Yeah.
so remand offenders are not eligible for these. Okay.
No, yeah, correct.
Okay. In terms of the recommendation that's a little further down the page on 218, when we're looking at the space, in the status update, you'd identified that ministries created a best practices / ideal ratio of program space per offender. What is the personal space that's required per offender? What has been deemed appropriate?
So once again, based on ideal or optimal group size, we worked with our offender services division, and the best ideal would be 16 offenders to one program room, 8 offenders to one staff, facilitator staff, which would demonstrate that in a 10-year period, we should be trying to identify at least 67 to 80 program spaces across the province for our adult offenders.
And so where are we at right now in terms of those benchmarks?
We're being creative.
Do you have a breakdown per
I do not have the breakdown right now. But what I can say is that our program staff in our facilities, with the infrastructure that we have, are able to provide programming, or are able to provide considerable programming. And they are creative, that they don't necessarily need a home base, that a lot of them have become mobile, and they're taking their program services directly to the unit. There was a day where offenders would always go to a program space, which still occurs, but we're also being creative where the program facilitator is actually going to deliver some programming right at the unit level.
Okay, I have no further questions right now, Mr. Chair.
Thank you. Any other questions on these recommendations in this chapter? Not seeing any, then welcome a motion to conclude considerations. Ms. Lambert moves. All agreed. So that's carried, and we'll move along to, I think, the final chapter for this ministry this morning, Chapter 30 of the 2018 report, Volume 2. I'll turn it over to the Provincial Auditor's Office.
Thank you. Chapter 30 of our 2018 report, Volume 2, on pages 221 to 224, reports the results of our fourth follow-up of the Ministry of Corrections and Policing's progress towards addressing 3 recommendations we initially made in our 2008 audit related to its processes to rehabilitate adult inmates in provincial correctional centers. The committee has previously considered and agreed to these recommendations. Offenders who receive rehabilitation programs have lower reoffending rates than those offenders who do not receive treatment, and they have an improved ability to reintegrate into their communities. By October 2018, the ministry has made little progress implementing these recommendations. While the ministry hired additional correctional staff in 2018 to monitor offender case management and begin tracking various information about inmates, it did not effectively monitor the proportion of inmates accessing planned rehabilitation programs. 23% of inmates' information we tested had inaccurate information used to monitor rehabilitation programming. The ministry also did not effectively monitor offender reoffense rates in relation to rehabilitation programs. Its monitoring and reporting of reoffending rates was limited predominantly to one correctional center and only for specific programs. Also, the ministry did not consistently follow its policy surrounding assessment of inmates' needs within 28 days. About 1/3 of assessments we tested were completed between 15 to 120 days later than the 28 days expected. In addition, the ministry did not always provide inmates with relevant rehabilitation programs consistent with those assessments. For 23% of files we tested, the ministry did not provide inmates with relevant rehabilitation programs before their release into the community. That ends my presentation.
Right now? Sure, and our provincial auditor would like to offer something as well.
It was asked when we're planning to follow up the last chapter. We've got it in our work plan for the next fiscal year, so we're aiming that it'll probably be in the next fall's reports, the 2020, so, the next fiscal. Thank you.
All right, well, thanks for the presentation and that information. I'll turn it over to the ministry for brief remarks, the deputy minister or related officials, and then questions.
Thank you, Mr. Chair. As you're aware, the ministry designs and provides programs aimed at reducing reoffending and improving the ability of offenders to reintegrate into their communities. And as you can imagine, this is not a simple task. The ministry continues to work on implementing the 3 remaining recommendations, and we are happy to answer any questions the committee may have.
Thank you. Questions? Ms. Mowat?
Thank you, and thank you for the status update as well. I'm just wondering where we should start. On page 221, the auditor notes that the first recommendations were made in 2008. And that there have been 3 subsequent follow-ups, and that there has been little progress made. So I'm just wondering if you can speak to what the challenges are with making progress on these recommendations.
Dora Schnell, Executive Director of Offender Services. In terms of the overall recommendations, a number of them were difficult to complete due to the switchover from our old IT system to our new IT system and being able to collect the information that we needed to collect. 2 of the recommendations are around monitoring program access and monitoring recidivism rates. As was noted before, we had some capability before the switchover that we lost during the switchover, which we're just regaining again past. And we're also in the process right now of working with our technology division around developing reports that will allow us to connect the needs that people have coming in with the programs that they then receive with the recidivism rates that follow. To do that right now would be all a manual process. Like it would be a very complex manual process that would be very difficult for us to accomplish. So we are looking forward to the reports that are going to be generated that will help us to be able to connect whether or not the offenders are accessing the services that they've been assessed to require, and also whether or not that has an impact on recidivism. In the meantime, we have been trying to do workarounds. So we have been trying to do some of our assessments, evaluations, I guess is a better word, on a more local basis. So we did, the one facility that was referenced was the Saskatoon Correctional Centre, and there was significant data collected there that was analyzed over a period of years to show that, that participation in those programs did reduce recidivism. We also did a very large-scale evaluation of our dedicated substance abuse treatment unit that we have at Regina Correctional Centre, and that did show reductions in recidivism as well. So we have been working to try and fulfill the recommendations on an individual basis. We absolutely understand that what the auditor's office is asking is that we be able to do this large scale and on a consistent basis. And that's what we're working towards with the development of the technology piece.
In terms of, on page 222, there's a mention of hiring additional correctional staff to monitor offender case management in early 2018. Can you speak to how many additional staff were hired?
There was a reintegration coordinator that was hired at each of the adult facilities. They were they're very important in a number of ways. One of the ways is that they are tracking all of the case management of the sentenced offenders in terms of whether it's being done and whether it's being done on time. And also whether or not those individuals are then eligible for the reintegration leave, which Mark had talked about earlier. So that's one of the important functions they do. One of the other important functions they do is they've been doing training with the case managers to try and develop better case management so that one of the pieces we're really trying to do is the other recommendation, which is to hit our policy requirements in terms of when the case management tasks are due. So I think those are sort of the two main functions that they've really helped with in the facilities.
Thank you. So the case management requirements, I think you're referring to the recommendation on page 223. So this is where the auditor found that correctional staff did assessments between 15 days to 120 days later than the guidelines expected. So have those numbers seen improvements now since hiring that staff?
So that's 70% were done within the correct timelines, then 30% were not. Since this report, we have trained our case managers. That was in February and March of this past year. And then we have plans that they're aware of that we're going to do a full-scale audit in the beginning of 2020. So we will, again, have numbers that we can give you at that time.
Okay. But you expect that it will make a positive, it will have a positive outcome?
Yes.
Okay.
We're also, I might add, looking at the actual process as well in relation to that, not only whether it's a capacity issue with staff, but perhaps the process that we go through that initial risk assessment, and case can be shortened or improved some efficiencies in that regard.
Okay. That concludes my questions, Mr. Chair.
You bet.
it kind of goes back to another question I asked. We're trying to evaluate how effective the program that we have in our facilities. I mean, we put them through programming, and how effective, and are they repeating, and we're trying to do it here. I mean, there's got to be, I would think there's enough research done on how effective rehabilitation programs are. I mean, maybe I understand we need to kind of track ours, but I would think that that work has been done in other jurisdictions as well, that we could have access to. I mean, you know, what are we getting for the dollar we spend on rehabilitation? And I don't know if you can ever kind of absolute dollar value it, but they are effective because there aren't the repeat offenders for people that have gone through the programming. Do we, again, look at other provinces, or do any other provinces have good data in this area that we can also look at and perhaps reassure ourselves that what we're doing is working?
Yes, absolutely. So all of the programs that we have adopted for corrections in Saskatchewan, we have either adopted best practice programs that are used elsewhere. So one of our programs is adopted from BC Corrections with their permission. They've done evaluations. They've shown it to be effective. Another one of our programs is adopted from the National Institute of Corrections. It's been evaluated several times. It's shown to be effective. Typically in the area of 20 to 30% reductions in recidivism. The dedicated substance abuse treatment program that I referenced earlier, we developed in Regina, and that was a development between us, the Ministry of Corrections, and the Ministry of Health, and at the time RQHR, the SHA. We've evaluated it, and we have in the order of 30% reduction in recidivism as well when we compare it against a sample of people who were queued up for the program but did not get in for a number of reasons. So we are very conscientious about trying to ensure in the best ways that we can that we're able to do at this point that our programs are effective. I understand this recommendation is just to make sure that so that we can continue to evaluate how they're actually being run, to just sort of validate that. Or, yeah.
Yeah, I would have a question to the auditor then. So what exactly are we trying to get at here when we're bringing programs in from other provinces that have proven where, you know, the programs are identical? I guess my question is to the auditor then, what are we exactly trying to get at here?
Excellent questions, you know, and I think, you know, if you go back to the original audit, we had some of that information in there and we looked elsewhere, and you're right, there is tracking elsewhere. We're bringing the programs in. There's a recognition that the manner in which the programs are delivered can differ. As indicated to staff, staff have been indicating in this meeting, they've had to be creative in terms of their delivery mechanisms because of space constraints. Also in the original audit, what we heard is that the composition of your inmate population may differ from one jurisdiction to the next. There could be impacts, cultural differences in terms of how you should be delivering programs and how well programs are received. So it's a case of looking at those programs that, you know, may in fact have adopted from elsewhere, which is great because not reinventing the wheel is always positive, and just seeing how are you doing relative to the others and what adjustments do you need to make for your particular situations. It's not unlike the ministry right now issuing policies wide and letting each facility to develop its own directives because it recognizes unique situations in each facility. It streamlines in terms of that philosophy of the ministry, you know, that you have unique populations, unique needs, and particularly your delivery mechanisms may vary from elsewhere.
Okay, I'll leave it at that for now. We could probably go for a long time on this. Thanks.
Any other questions? Yeah, certainly it does stand out that, and I know there's a response coming together here, but being able to track recidivism is pretty, you know, foundational to understanding the effectiveness of programs. So it seems that it was a real gap that it wasn't, you know, being monitored or being reported out. And I'm glad that that information is going to be, you know, collected and organized in a way that can be put to use by the ministry. It seems as well throughout, you know, many of the chapters that we've had, including this one, that just space is a real challenge in this system. And, you know, it speaks to me when I see that around the rehabilitation space and the challenges and pressures there, but as well just the number of folks. I think it was the Saskatoon audit around why folks aren't, why inmates aren't doing their medical assessment, and there's just not sufficient space, I think, which was identified for privacy in that sort of disclosure, and that's pretty important stuff. So anyways, we'll leave it there for today. There's other places that we can focus on those conversations. I would welcome a motion to conclude consideration of Chapter 30. Mr. Weeks. Now, is that agreed? That's carried. So I'll just flip it over for final comments, but thank you very much to the officials that are here today for their time, for their attention to the questions, and to all officials for their work on these very important recommendations and their work on behalf of Saskatchewan people day in, day out. Any final comments from the ministry here today?
Other than thank you as well to Chair, Co-Chair, and Committee. Thank you to Provincial Audit. I think, as mentioned at the onset, that what you evaluate and assess in relation to our policies and what we do operationally is a really good benchmark for us to look at improvements and possibility of change. And I also just have to thank my team, your team, for what they put together in relation to this response today, as well as what they were able to put forward in relation to the questions that came from the committee. Thank you.
Thank you. At this time, we'll take a brief recess. We were scheduled to hear the Water Security Agency, or to have them before us at 10:30. We've put the call out to them for them to appear sort of sooner if possible. So we'll take a brief recess and reconvene when they arrive.